Hi, my name is Avery Ash. For this week's interactive case study, we are talking about tissue plasminogen activators in the treatment of ischemic strokes. There are two different types of strokes. A hemorrhagic stroke is caused by a rupture of a blood vessel that's going to the brain, and an ischemic stroke is caused by a blockage in a blood vessel going to the brain. Treatment of an ischemic stroke involves removing this blockage so that blood can flow into the brain. And this blockage removal can be done via surgery or with drugs. Anti-inflammatory agents such as aspirin can do the trick, as can tissue plasminogen activators, also known as TPA. And today we are discussing TPA. When someone is admitted to the hospital with a stroke, the gold standard is to give the patient an IV of TPA. It is most effective if the patient receives this within the first 3 hours of symptom onset. And TPA is a naturally occurring protein. It is a serine protease, which is an enzyme that, a class of enzymes that cleave peptide bonds in proteins. And TPA is involved in the balance between thrombolysis, which is the treatment to dissolve dangerous blood clots, and thrombogenesis, which is the creation of these blood clots. At the site of the thrombus, TPA and plasminogen will bind to the fibrin surface, and this induces a conformational change. And this conformational change is what facilitates the conversion of plasminogen to plasmin, and plasmin is the enzyme that does dissolve the blood clot. So here I have a picture demonstrating this. You see the TPA is leaving the endothelium, which is where TPA comes from naturally in the body. It is also given to patients via intravenous methods. So the TPA binds with the plasminogen on the fibrin, which is the blood clot, and together the TPA catalyzes the plasminogen, which activates its transformation into plasmin. And then the plasmin does its job of degrading the fibrin, and you see all the little pieces here floating away. And this process continues. More TPA binds to the plasminogen, more plasmin. This continues until the blood clot is reduced, either completely or to a point where blood flow can continue as normal. As I said, TPA is a naturally occurring protein in our bodies. In normal circumstances, there is a balance between fibrin accumulation, or the formation of clots, and its subsequent removal by naturally occurring TPA. Certain pathological conditions, such as genetics or lifestyle choices, can cause this balance to be disturbed, and this results in blood clots. And this situation is where medically administered TPA comes in to restore the balance and to remove said blood clots. And here are my sources. Thank you for coming with me on this journey to learn about tissue plasminogen activators, and have a good night.